Welcome to Fight Cancer Global's informational video series. Our aim is to empower individuals with knowledge and resources to combat cancer. Today's video will explore how doctors decide whether a patient requires surgery for cervical cancer, offering valuable insights and actionable steps to aid you and your family in the fight against cancer. Deciding whether surgery is the right course of action for a patient with cervical cancer involves careful consideration of many factors. To begin with, the stage of the cancer plays a significant role. Early stage cancers, such as stage IA and some stage IB and IA tumors, are often treated with surgery. This may involve removing the cervix and uterus in a procedure known as a hysterectomy, or possibly a more extensive surgery that also removes the lymph nodes in the pelvis. The type of cervical cancer is another important factor. The two main types of cervical cancer, squamous cell carcinomas and adenocarcinomas, are generally treated similarly, but other less common types may influence the choice of treatment. Next, a patient's general health status and age also come into play. Certain health conditions, or being of an advanced age, may make the risks of surgery outweigh the potential benefits. In such cases, other treatments such as radiation or chemotherapy may be considered. Another key consideration is fertility preservation. For young women who wish to have children in the future, less invasive surgeries or fertility-sparing treatments may be considered. This could include a cone biopsy or a trachelectomy, where only part of the cervix is removed. Additionally, the patient's personal preferences and understanding of the potential risks and benefits are essential to the decision-making process. Doctors should provide clear and comprehensive information to allow the patient to make an informed choice about their treatment. It's also worth noting that sometimes, surgery is used in combination with other treatments. For example, a patient might receive radiation or chemotherapy to shrink the tumor before surgery, or to kill any remaining cancer cells afterwards. Importantly, the decision is typically made by a multidisciplinary team of specialists. This team can include a gynecologic oncologist, a radiation oncologist, a medical oncologist, and other healthcare professionals who work together to develop the most effective treatment plan for the individual patient. Lastly, participation in clinical trials is another consideration that might impact the decision. These trials offer access to new and potentially effective treatments and contribute to advancing medical knowledge. In summary, deciding whether a patient with cervical cancer requires surgery involves a holistic consideration of many factors. These include the stage and type of cancer, the patient's general health and age, the desire for fertility preservation, personal preferences, the potential use of combined treatments, the recommendations of a multidisciplinary team, and the possibility of participating in clinical trials. Thank you for viewing this informational video brought to you by Fight Cancer Global. For additional content and support, you can visit our website at www.fightcancerglobal.org, where you will discover a great many resources as well as a supportive community that knows your cancer journey. Let us join forces and make a meaningful impact in the fight against cancer.